Yeah. Yeah, so first of all, I would like to acknowledge the Wendat, Atikamek, Maliseet, and Innu Nation that took care of the land on which I am standing right now in Quebec City. So as Sumet said, I'm an associate professor at the Department of Family Medicine and Emergency Medicine at Universite Laval, but I was trained in public health and health promotion. I have been doing what I aim to be respectful, reciprocal, participatory research with Indigenous communities since 2013. And so my research program is aimed to improve cultural safety of care for Indigenous population. I am also interested in issues of racism in the healthcare system. And one axe of my research program is also devoted to improving medical education. And I would like also to mention that I'm co-leading with Alex McCumber. I'm co-leading the Indigenous expertise of the Quebec Support Unit. So the article that we're going to discuss today is about a project that I did in 2017, 2018. So it's almost 5 years right now, but it was a project funded by a collaboration grant from the CIHR, a collaboration grant for patient-oriented research. And there was also matching funds from Diabetes Canada. And so the project has a specific focus on people living with diabetes. Just to explain a little bit the context of the project, as you know, patient-oriented research aims to promote active patient engagement in research. And so it has the potential to increase research quality, validity, and relevance, while also improving health outcome for the general population. And participatory research such as POR, is it okay if I say POR? It's easier for me. So POR is patient-oriented research, are preferred when working with groups of people who have been historically disempowered or had less decision-making power or access to health research. And there's a growing concern that people involved in POR do not reflect the diversity of the population, but rather those who are more easily engaged with institution, organization, and society. So this is in reinforcing existing societal power imbalance because members of more marginalized population are seldom represented among patient partners involved in patient-oriented research. So there's a need to broaden the range of people and the range of experience that are represented in patient-oriented research. And to do so, we need to find more creative ways to engage population, which are characterized as hard to reach, but might in fact be overlooked or ignored by society. And so engaging Indigenous people in POR is crucial to amplify their voice in health research and policy. So this project was intended to find out what are the most effective strategies to increase patient-oriented research with Indigenous patient partners. The formal goal of the project was formulated as recruiting, orienting, and supporting Indigenous patient partners to play an active role in health research in Quebec. And more specifically within also a national diabetes research network, which is Diabetes Action Canada, because there was a lack of representation from Indigenous patient partners. So this was only a one-year project, one-year engagement initiative, built on a participatory approach involving researcher, Indigenous people living with diabetes, as well as Indigenous and healthcare organization in the province of Quebec. So how the project went. As a first step of the project, we created a core committee of organizational partners and research team members to define the goal and the process and the procedure of the initiative. It was in May 2017. And then after that, this group of partners helped recruit 8 Indigenous patient partners, 4 men and 4 women living with diabetes. And this core committee also helped to identify strategies to empower patients in their role as patient partners. So the project went from June 2017 to June 2018. And so project member, including research team member, organizational partners, representative, and patient partners, met 8 times during that period, and mostly via teleconference, because the budget of the project was really small, and meetings were held in French. So who were these organizational partners? They were from 5 organizations that we contacted before the beginning of the project. So there was health centers in One-yea, which is an Indigenous community close to Quebec City. There was also Indigenous friendship centers in Joliette. I guess you are familiar with the Indigenous friendship centers. There was also a health center in Manawan, a community health center in Manawan. And we also contacted a band council, the band council of the Malicite Nation in Quebec. And there was finally a healthcare center who was not located in an Indigenous community, but was providing services to the community of Manawan. And so with these organizational partners, we met and we kind of envisioned the mission of the project, which was formulated as giving a voice to Indigenous patients in research concerning them. So after the second meeting, so after this first meeting with the core committee, we had the second meeting where we decided to use a flyer to recruit patient partners. And so the flyer was useful to synthesize the information about the project, but the patient partner were generally recruited by word of mouth and through contacts in the partnering organization. And so the patient partners came from the community of Manawan, and some of them were also at Quebec, but living in Joliette. We had also 3 patient partners from the Malicite Nation. There was 1 person from Odanak, which is an Abednakis community, and there was someone who was Hindu, but was living in Trois-Rivières, that we reached through the Indigenous Friendship Center. The project culminated in a one-day in-person training workshop. So this is the photo from the workshop, which aimed to reinforce the project member capacity regarding patient-oriented research. And this training was developed in collaboration at that time with the Quebec Support Unit. After this short initiative, 1-year initiative, we decided to do an evaluation of this project to garner a lesson from the initiative and identify the best strategy to engage Indigenous patient partner in patient-oriented research. And so we used an evaluation based on a case study design involving documentation analysis and interview with project member, so with patient partners, but also with organizational partners. And so the patient partner were both participant, but they were also involved in the last step of the evaluation. So the result interpretation and the knowledge translation. So some of them also attended scientific events to present the result of the initiative. And unfortunately, I could not invite them today because they speak French. And for many of them, it's already their second language because they are also speaking an Indigenous language. So they could not attend the presentation today. So the evaluation of the project, as I told you, relied on documentation from the project, but also on interviews with project members. So we had 4 patient partners that accepted to take part in the interviews and 2 organizational partners that also took part. And the interviews were meant to identify the strength and the weakness of the initiative, as well as the barriers and the enabler to Indigenous patient engagement in research. So the evaluation, which is the object of the article that I present today, the evaluation result offer lesson from partnering well with Indigenous patient partners in research. And these lessons pertain to 4 components of patient engagement, which are the initiation of partnership, interest development, capacity building, and long-term involvement in research. And I'm going to detail all these lessons. So the first, the initiation of partnership. So you might know that recruiting Indigenous patient partners, but recruiting patient partners is a crucial first step to engage patient in patient-oriented research. It involves finding effective ways to identify and approach potential patient partner to interest them in engaging in research. So in this project, we learned the importance of initiating first contact with potential Indigenous patient partner in their organization, in their milieu, in their communities. But due to budget constraints, this project relied mostly on remote contact, phone, teleconference with participants. And so this was perceived by patient partners and organizational partners as well as a main limitation to recruitment. So this is something that we learn. And another lesson is that in order to recruit, we can leverage existing relationship with local organization, community leaders, or trained patient partners. And this was one strategy that we used a lot in this project that proved to be successful. Regarding interest development, so a finding is that building and sustaining the interest of patient partner in patient-oriented research rely on using a number of mechanisms to ensure repeated personal contact and continue the relationship. So really it's in the in-person training workshop where patient partner got to connect face-to-face that we had the opportunity to really bond. And so this created bonding between the patient partners, but also between the organizational partners and the research team. And so this is really something really essential. Sustaining interests also involve frequently checking in and maintaining ongoing contact with patient by phone or by email or by their preferred means of communication. It might also sometimes be social media, messenger. Also, another lesson is to emphasize the potential impact of the project for patient and their community. While patient-oriented research does not necessarily focus on the community, on the communities in which people live, for Indigenous patient partners, it was important to understand the potential impact of the research project for their community. And this was really a main factor to ignite interest and motivation in the research. Regarding capacity building, what has proved as to be a challenge is to establish a clear understanding of the patient partner's role. And so we had to really foster skill development, knowledge acquisition, and familiarization with conceptual tools for patient partner to be able to really understand this concept and be able to enact their role. And so in this initiative, the patient partner concept was central, but it was really a difficult concept to grasp for some people. And we had to multiply the way in the strategy to exemplify it. So we had presenters such as patient partners, experienced patient partners who came and talked about their experience in POR. We had also training. We had various ways to explain this concept. And another important point is that the in-person one-day workshop was really a key moment. To develop skills and also to understand the project, the initiative. Throughout the initiative, we tried to offer many opportunities for engagement in external research project. And so this allowed patient partners to appreciate the spectrum of projects they could engage in. And also it helped them to better understand what POR was about, what is a patient partner. Also to facilitate involvement in research, we understood that being accessible is really important, accessible and flexible. So it means providing full opportunity for all team members to be involved and participate. And so we were really flexible in the time that the meeting could be scheduled according to the patient partner's availability. We were also flexible in the communication means that were used, because as you know, access to communication technologies is important to consider, especially for patients that are located in remote communities and have limited internet or telephone access. And we also really try to adapt our language to different level of scientific or academic literacy. Literacy is definitely also something to consider. And another important point is to value patient involvement. As you might know, a patient partner giving their time and energy to a research project is an invaluable asset to our research team. So letting them know that we have that they are appreciated and their contribution, that their experience, that their knowledge impacted the project is really crucial to foster their involvement in other projects. Okay, so now I'm arriving at some specific challenge that we encountered in the context of this project. So the first challenge I would say is to not consider Indigenous population as an homogeneous ethnic group. So not only do they have different cultural backgrounds, but they also have different levels of engagement with their own culture, their own tradition and belief. In this project, the patient partners came from 4 different communities and nations, all with different level of knowledge of and attitude toward their culture. So this reinforced the importance of learning and knowing the cultural backgrounds, the traditional beliefs, the social customs of the people with who you were interacting. So working with a diverse group of patients like this triggered the need to honor diverse belief, tradition, and needs, but also to create a common, safe space to encompass this diversity. So the lesson that I would say is really important to create a common safe space to encompass this diversity. Another challenge another challenge or issue in this kind of project is to fully understand the influence of social and historical context in which engagement occurs for Indigenous patient partner. So they, as you might know, they share a similar story of oppression and marginalization related to colonization. And this might negatively affect their attitude or relationship with institution and with research. So in this initiative, for instance, some participants lack self-confidence in their capacity to participate. Some even felt like imposter in their patient partner role. Some questioned their ability to do the work, and some also did not trust the institution and were reluctant to provide personal information to the university. So all this point to the need to be conscious of the legacy of power dynamics that may affect Indigenous patient partner during the engagement process. And also this point to the need to equalize the power dynamics as much as possible in such a project. Finally, a third challenge that you might also have encountered in the context of patient-oriented research is to work with ill-prepared institutions to manage patient partnership and research. For instance, in this project, the financial compensation payment and the expense reimbursement took many, many weeks to process. And this kind of delays is not always justifiable from a patient partner perspective. And it is especially hard to endure for a financially disadvantaged patient. And another barrier at our institution is that there's no relevant accounting code to categorize patient partner contribution at that time, at least. So they were treated as experimental subject, in which case they can receive non-recurring financial compensation, which should not exceed $100 and is not taxable. Otherwise, they are treated as institutional employees receiving a taxable salary. And these two scenarios pose serious challenge for some Indigenous patient partner who are receiving social assistance, for instance, and cannot receive more than a certain amount in donation or in salary per month. So we really need to heighten the capacity of our institution to work with these kind of partnership. So in conclusion, the result of this evaluation are consistent with the existing literature around patient engagement in research, but our result nonetheless underline some elements that are specific to the engagement of Indigenous patient partners, such as the importance of community ties involved in recruiting, sustaining, and motivating patient partners. And so this finding highlights a gap between the Western model of patient-oriented research, in which individuals are conceptualized as independent of their communities, versus the Indigenous model of health research, in which individuals are not separable from their community. Another important lesson is to be flexible enough to accommodate different capacity level, which may be financial, technological, or concerning literacy. And this can be challenging when working with patients from diverse backgrounds and from diverse communities. And finally, the last point that I already put some emphasis on is the importance of consistently valuing patient partner contribution and participation. And these lessons might also apply to other groups, to the involvement of other populations which share similar history of oppression in the society. So this might be also something that is relevant for the work with these kind of group of patients. So that's it. Miigwech, merci, thank you.
Thank you very much.